Good afternoon, everyone, and welcome to today's webinar. I'm Michelle Dallafor, Senior Vice President for Budget and Tax Policy at First Focus on Children, a national child advocacy organization dedicated to ensuring that children are a priority in all federal budget and policy decisions. Thank you for joining us for this opportunity to present the findings from our 2025 Babies in the Budget analysis and a new fact sheet that builds off that analysis to show how federal investments are flowing to the states. The research is clear. Early investment in children leads to positive near and long-term outcomes for them, their families, and our communities. To bring this into focus, we're pleased to be joined by Dr. Teresa Granillo, CEO of AVANCE, who will share insights on the work she leads in Texas. Thank you for being here today. Before I briefly walk through the agenda, I would also like to thank Pritzker Children's Initiative for their support of this ongoing budget work at First Focus on Children. I also would like to thank my terrific colleagues for all their efforts to put this webinar together and manage its technical operations as I speak. For the agenda, we'll start the webinar with my colleague, Chris Becker, who will present our Babies in the Budget and state fact sheet analysis. And we will pause. We can take questions in the chat during the presentation, but we will also pause at the end of his presentation to take any questions. And so you don't have to ask. Yes, we will be sharing his slide deck with you as well. After Chris, we will hear from Dr. Granillo, who will share a Texas perspective on the different policy and budget changes they face and how they are responding. And in the last 10 minutes or so, I'll facilitate a Q&A question with Chris, Dr. Granillo, and my First Focus on Children colleague, Avery Pakulis. Again, welcome, and thank you for joining us today. Now, I am pleased to introduce Chris Becker, who is our VP for Budget Policy and Data Analytics. Chris, please take the mic and share the analysis you've conducted. Again, welcome, everyone.
Thank you, Michelle, and thank you everyone who is joining us today. We're really excited to share this work with you. Michelle, could you put up the slide deck, please? All right, so I am going to present on our Babies in the Budget product, and then talk about federal investment in babies at the state level, which is our new fact sheet that we're really excited to share with you. Next slide, please. So, what is Babies in the Budget? It is basically an extension of another project that we do, which is called the Children's Budget, where we track federal spending for children 0 to 18. What the Babies in the Budget does instead is the same idea, but we look at children from 0 to 3, so children under 3. And the reason we think this is really important is that those first few years are arguably the most critical years in a person's life. What happens in those first few years uh, affects a person's long-term education, their health, their cognitive development, even their labor income down the road. And so, if you don't make the proper investments in those early years, you may never be able to reverse that. You may never be able to help kids catch up. Those first few years are so important. And so, what we do in Babies in the Budget is we look across the federal government at all the major programs that invest in children under 3. We track almost 150 programs in total across lots of different departments, from labor to HHS, education, anything that invests in children in some way. And our goal here is to understand whether babies are being made a priority in the federal budget. And to that end, what we do is we calculate the total amount of money that is flowing to children 0 to 3. And we estimate the share of federal spending that goes to that population. And so out of all the federal money that we spend, how much of that is going to babies? So that's our baby share, as we call it. And the idea is that if that share is high, if it's increasing over time, we would say that we are prioritizing babies. Unfortunately, as you'll see, for the most part, we do not. The share is going to be is far too low. Um, so, uh, um, Sorry, Michelle, I wasn't done on the first slide. Can you go back one? So anyway, what we do is we look at all these different programs. So some of them are things like Healthy Start, which are just exclusively investments in the youngest kids. And then some of them are things like Medicaid or SNAP or the Child Care and Development Block Grant, which serve different populations. And in those cases, we estimate the share of that spending that goes specifically to babies. And then in the report, what we analyze is the share, like I mentioned, as well as how the money that we invest is keeping up with inflation. So ideally, we would see that not only is spending on babies increasing over time and their share is increasing, but that investment is keeping up with inflation. If you keep funding flat for example, nutrition support, and food is getting more expensive, that means that money is going less far, and that's basically a cut. So we also benchmark whether spending on babies is increasing relative to inflation. Okay, next slide, Michelle. Thank you. Okay, so our big finding here, the one number I really want you to keep in mind is 1.59%. The share of federal spending on babies is only 1.59%. And so out of every $100 that we spend in the federal government, only $1.59 of that goes to babies. So less than $2 of every $100 we spend. Um, Obviously, I think that number speaks for itself. That's obviously a very small share. It's also less than what the population of babies is in the total population. And so babies make up 0 to 3 makes up about a little over 3%. So we're not even proportionately investing in babies relative to the size of their population. And if anything, this is a population we think should be disproportionately invested in because these are such critical years. The other bad news is that unfortunately we're moving in the wrong direction. So you can see there that in 2021 we actually reached a baby share of 1.98%, so almost 2%. That's still really low. It's still not enough, but it's a lot higher than where we are now. So since 2021, which is actually the highest share that we've ever recorded, we've fallen by almost a fifth. So a 20% drop from that peak. So the share is too low, and unfortunately, we're actually moving in the wrong direction. Next slide, please. Okay, the other thing we look at is we try to break up the analysis as well by issue area. And so we track these 6 different categories: early childhood, health, housing, income support, justice and child protection, and nutrition. And the reason we do this is that we think that babies have a lot of different needs. And we ideally would be investing in babies holistically. We would be hitting their early childhood needs. We would be hitting their health needs. We would be giving cash support to supplement the income of parents. All these things that have different goals but work together. And so when we look at the trends issue by issue, they're mostly pretty discouraging still. If we look at that change from 2021 to 2025, 4 of our issue areas see a pretty big decline: early childhood, income support, justice and child protection, and nutrition. And then health and housing are our 2 only bright spots. So that's kind of how you look issue by issue. I'm happy to talk more about any of those specifically. Next slide, please. Okay, so that's kind of the big picture numbers, and you can see a lot more detail if you look at the full Babies in the Budget report. But what's actually driving that shift away from investment in babies? Why are we moving in the wrong direction? And the main reason is that in 2021 and 2020, 2022, right, during the pandemic, we did a lot of really great things that worked really well for the entire population, but especially for kids and especially for our youngest kids. We had the economic impact payments, which were the checks that were the stimulus checks, basically, that went to all people, of course, but guaranteed money for people with babies. So just a check that came to people to supplement their income for whatever they needed. We had the Child Care Stabilization Fund, which offered extra support for childcare. We also increased the Child Care and Development Block Grant temporarily in 2021. We had emergency allotments for SNAP, which increased nutrition support. And then we also had a fully refundable child tax credit. What that means is that everyone, regardless of income level, is entitled to the full child tax credit. That's not how the policy normally works, and it's not how it currently works. Right now, there is basically a penalty for people at the lower end of the income spectrum. So as income increases, you actually get a larger credit. And so it's the lowest income families that get the smallest amount of credit. And so what we did in 2021 is we said we're going to make that fully refundable so that everyone is entitled to the full credit, including those who are most needy. Um, Unfortunately, all of these things are now gone. We got rid of the economic impact payments. There's no more child care stabilization fund. Child care and development block grant is back to its usual levels. The child tax credit is no longer fully refundable. So again, we're penalizing the lowest income, most needy babies. And we have SNAP levels have gone back to their regular level. So overall, we had all these things, worked great, cut the poverty rate for children in half, in fact, these programs did, and we let all of that go away. And so the bad news is we moved in the wrong direction. The good news is this is a great checklist of next steps that could be taken. We could do all of these things again. We know they worked, and it's just a matter of having the political will to go back in that direction. Next slide, please. Unfortunately, we have a lot of reason to believe that there is more bad news to come. Last year, the Congress passed H.R. 1, the reconciliation bill, also called One Big Beautiful Bill. And unfortunately, this is not a bill that we expect will be good for kids, and especially kids, our youngest kids. So HR 1 specifically targeted two really important programs for cuts. Medicaid, which offers healthcare support for lower income people, many children and many babies. And then SNAP, which is a nutrition support program. And the reason this is so concerning is that these are programs that disproportionately serve children and especially these younger children from ages of 0 to 3. And so if we look at the total federal budget, those two programs, Medicaid and SNAP, make up about 11.4% of the federal budget. So obviously a pretty big chunk, but only 11.4% when we're looking at the entire budget. On the other hand, if we look just at the spending that flows to babies, children 0 to 3, those two programs make up 47.3% of all federal spending on babies. So just those two programs is almost half of all our federal support for our youngest kids. And it is those programs that were targeted by the reconciliation bill. So this is a bill that is disproportionately targeting babies to a huge extent. That is going to be a disaster. Now, none of this shows up in our numbers yet. So when you're seeing that 1.59% number, that's way too low already. That does not include any of these cuts because these cuts are over the next decade. We don't know exactly how large they will be. Those numbers are going to show up in coming years, in coming babies in the budget reports. But what I want you to keep in mind is that 1.59% is really bad. It's probably going to get a lot worse because we are disproportionately targeting babies with current law changes. Next slide, please. Okay, so that's kind of the national picture. Not a very happy one, unfortunately. But now I want to share a bit about our new analysis, which is looking at what's going on at the state level. So we've got all of this federal money, this 1.59% of money that's going to babies. We wanted to know, how is that being distributed across the states? How is that money flowing into the states? And so what we did is we looked at 13 of the biggest programs that we track in the Babies in the Budget book. These include Medicaid, SNAP, Child Care and Development Block Grant, Early Head Start, uh, WIC, Children's Health Insurance Program, and a few others. And these 13 programs account for over 75% of federal support for babies. So it's only 13 out of the 150 programs, but it's a pretty large majority of the actual dollars. Okay. And so for each of those 13 programs, what we did was we collected data on how much of that spending, how much spending goes to each state. So how that spending is distributed across the 50 states. And then within that pot of money, for each of these programs, we estimated the share of that money that is going to children 0 to 3. So sometimes we use census data to figure that out. Sometimes the actual data from the programs listed that. But in some way, we estimated what share of that funding is going to each state for the population 0 to 3. And so then we get that chunk of money for 0 to 3 for each of the programs, and we add them up to see how much money for is flowing to children 0 to 3 in each of the states. That's the basic idea. Next slide, please. Okay, so here is our big picture map that shows most of the findings kind of all in one place. And what I'm showing here is a map where each state is represented by its per capita spending on children 0 to 3. So this is the amount of federal spending that goes to that state per child 0 to 3. And so if you see a state like New Mexico, Oklahoma, Louisiana, those are kind of the darkest shade there. That's those states are investing anywhere from 8,000 to around 10,000. Whereas in other states, the money flowing there is a lot less per child. So something like Wyoming, New England, or Nebraska, those are from about 3,000 to 5,000. So you can see just how it varies from state to state, a pretty wide range here. And now, and I'll talk, in the rest talk a little bit about what is driving that variation across the states. Next slide, please. First of all, I want to put these numbers in context. You saw that the numbers range anywhere from $3,000, 3.6 thousand, $3,600 up to about $10,000. And that might sound like a decent amount of money per child, $3,000 to $10,000, but it's not all that much money compared to the actual cost of raising a baby. So, for example, the cost of raising a baby in the first year, in terms of, just out-of-pocket costs that families have to pay, whether that's childcare or diapers or formula, that comes to around $20,000 most of the estimates you'll see. So 20,000 is a lot more than 3 or 10,000. You also can look at the actual health costs associated with babies in those early years, because a lot of the programs we're tracking, by far the biggest program we track for babies is Medicaid. That's not money that's going, directly into people's pockets. That's money that's paying for medical services. And so those costs are also really high. Um, Also around $20,000 for babies just in that first year. And then finally, if you look at the average annual Social Security check, the average amount that someone is getting for Social Security through the year is $24,852. And so these per person spending on babies is actually not an enormous amount of money compared either to the cost that babies cost or to the amount that, other populations might get. Um, so keep that in mind when you're seeing just kind of the scale of those numbers. Um, Next slide, please. Okay, the other thing we can look at is instead of looking at per baby spending, how much are we spending per child, is to look at just what is the total amount of money going to each state for babies. Obviously, bigger states generally receive more money, higher population, but this is kind of a map showing when we're talking about federal spending for babies, how much is on the line for each state. And so for smaller states, something like, Vermont, New Hampshire, it's kind of in those low hundreds of millions. Whereas all the way up to some of the biggest states, it can be in the 2 billions, the 8 billions even. And in fact, our largest state here is in fact Texas. They're at $8.552 billion. So Texas is the single state with the largest single investment in babies. And so luckily, you'll get to hear a lot more about Texas later in the webinar. Next slide, please. Okay, so like I mentioned, like you could see with the map earlier, there's a pretty large variation in how much we spend per baby across the different states. Alaska is actually the largest, the state with the largest investment, followed by New Mexico, Louisiana, Oklahoma, and Kentucky. So a lot of these kind of southern states. as well as Alaska. And then at the lower end of the spectrum, states like Utah, North Dakota, South Dakota, Nebraska, and Virginia are, significantly lower, more around 3 to 4,000. So there's just a wide range of how much money is going to each state per baby. So the question then is kind of what is driving that? Next slide, please. One thing we find is that geography is pretty important there. If you had looked, kind of the map we showed earlier, there's a lot of there's a lot of patterns if you look area to area. And in particular, I think the biggest thing that stands out is that the southern United States receives the most investment per baby. And so we can see that here if we kind of aggregate up across these different regions. The South is definitely the region that receives the largest investment per baby. West and Northeast are pretty close, and then Midwest is kind of on the lower end. So there is a geographic component here where southern states are the biggest, the biggest, the states that get the most investment, I'll say. Next slide, please. Now, one thing we thought is that maybe there'd be a big difference between red and blue states. That turned out not really to be the case. If you look at the red and blue states, on average, they receive almost exactly the same amount. So blue states 6,600, red states also around 6,600. It's only a very small difference per baby across red and blue states. So it's not as if red states are getting all the money, blue states are getting all the money. It's really a blue and red. We are all benefiting from this spending. Next slide, please. What does matter a lot in terms of how much money you get is the poverty rate. And so what we see is that the states that are on the lower end of poverty, and this is a poverty rate just for babies, by the way, the lower end of poverty for babies get less money, and on the higher end, they get more money. So if you're above 16%, you're getting about $7,000 on average, whereas below 11%, it's around $5,000. This is good news. This means that if there is greater need in the state, if there is more babies in poverty, we are allocating more money to those states. So haven't been very positive yet today, but that's my one bit of good news is that at least these programs are well designed enough that we're targeting the money towards states that do need it most. The other note would make here, just so everything's clear, is that this poverty rate is before these transfers happen, before Medicaid, before SNAP. And so this is more a reflection of the need of these different states in terms of poverty. Poverty is obviously actually reduced when this money flows into the hands of babies. And so, yeah, this is need rather than showing like the effect of these programs. Luckily, these programs do have a pretty substantial anti-poverty effect. Next slide, please. The other thing we wanted to look at is Medicaid and SNAP. Like we said earlier in the presentation, Medicaid and SNAP are really, really important for babies. They make up almost 50% of spending for babies nationally. And those are the programs targeted by the One Big Beautiful Bill. So we also wanted to look at this state by state. Is it true that all of the states are really dependent on Medicaid and SNAP for their federal support for babies? And the answer is yes. Out of all these 13 programs we track, which again make up almost 3/4 of total baby spending nationally, we find that 49 out of 50 states, more than 50% of that money is just Medicaid and SNAP. So Medicaid and SNAP make up over half of the spending that we track in almost every single state. The one exception is Massachusetts, which is really close to 50%. It's at 46.9%. So there's no state that is where babies are not vulnerable to the cuts that are going to happen because of the One Big Beautiful Bill. All of the states are really have the babies in them are going to be really heavily impacted. Alaska, again, I believe Alaska and Washington are the two highest here. Texas, you can see, is also in the highest bucket. So some states, this is like a really large proportion of their baby spending. Texas being one of them. Next slide, please. The last thing I wanted to talk about was maternal and infant health. We really think that maternal and infant health is one of those especially important areas to invest in. if we're not taking care of mothers prior to and after birth, babies are at a huge disadvantage. And of course, we want to make sure that we are supporting infant health in those early years. Health problems in early life can be a huge determinant of what goes on later in life. And so maternal and infant health is so critical for babies. And so what we're showing here is out of all the spendings that we track, how much maternal and infant health makes up how, maternal and infant health programs, their proportion of this spending that we're tracking state by state. And once again, it's just a huge proportion. Every single state, more than 50% of their money goes to maternal and infant health out of the programs we track. And again, what is the biggest maternal and infant health program? It is Medicaid. Medicaid serves lots of different populations, lots of different children, but it is by far the biggest program flowing to babies and by far the most important program for taking care of maternal and infant health. And again, that is the program that is being targeted by the One Big Beautiful Bill. So again, this is another area where we are doing a lot of good things in maternal and infant health, not as much as we should be, but we're really the most important program here, Medicaid, really is in danger. Um, and I think that's all I got, right, Michelle? Any other slides? Yep. All right. Thank you so much. I am happy to take any questions, and you can definitely follow up with me afterwards too. That my email's right there. And I'll stop there.
Video. Thank you, Chris. I'm Michelle, if we could, is it possible to go back up to the babies in the budget fact sheet? Chris, I just want to go back to where you have the chart that you show where we saw some increases in housing and health
Mhm.
in babies in the budget analysis. I don't know, Michelle, if it's possible to put that back up. But I thought as a group, we could just talk about that a little bit because in the health space, the increase was largely driven by the mandatory side of the budget ledger and the increases in the Medicaid program. I'll pause there and Chris will correct me if I'm.
Nope, you're exactly right. So that is a really important distinction. I didn't want to bog you guys down too much in budget talk, but mandatory programs are ones that we have we have, the rules of the program are set up that set participation, they set who's has access to them, and then we provide money in proportion, to that need. And so, for example, over time, if there's more people who are need Medicaid, Medicaid increases. So the really big advantage of mandatory programs is that, at least to some extent, they will increase with need, and they kind of automatically increase without Congress having to proactively do anything. So Medicaid will keep up with a growing population, for example. Whereas discretionary programs are ones that Congress every single year has to decide to fund again. So the great thing about a lot of the health programs, including Medicaid, is that some of them are mandatory, meaning that we don't need to rely on Congress every single year to say that we're going to do Medicaid funding. We have Medicaid funding, and it has increased over time. And so that is good news. It is not suggesting that Congress did anything to make it better. It's not something that they proactively made better. It's something that increased by itself. And so we track that in the budget book. We are happy that happens. We're happy that these programs are mandatory so that we actually do see that increase. But don't think of that as like, oh, Congress really decided to invest in, healthcare for babies. That is not the case. Housing actually was an increase in discretionary programs, so that's a little bit more. It's a lot of rental assistance programs mainly, like tenant-based rental assistance, project-based rental assistance, different programs that provide money for people to get housing. So that's actually a bit more of an encouraging, like Congress actually did something, that sort of deal. But I will say most of that increase was in the early years. There's not been a lot of progress on housing in the last couple of years.
And I think I would just close that out by saying you're hearing a lot about passage of a budget resolution and what it means for the Department of Homeland Security funding. That is on the mandatory side of the ledger largely, and that is where we are concerned that Congress will decide to pay for those increases, we're going to come back to the two biggest mandatory programs that support children, the Medicaid and SNAP programs. And that is when the changes start to drop the funding available, when they're making policy changes that reduce eligibility, for example. And then on the housing side, what I would say, because if you take a look at the president's budget requests for the upcoming fiscal year, there are a number of program eliminations that we track. And I think Avery could mention a handful of them in the early childhood area. But we've had some luck in recent years convincing Congress and advocating for Congress in the annual appropriations process for the discretionary programs to do right by kids. There's far more to do, as you can see here. But my closing point would be we're fighting to maintain mandatory programs and the discretionary programs at the same time. And then, Avery, I would just say, are you able to mention what some of the drivers were for the decrease in early childhood, or Chris?
Yeah. Oh,
Meant,
well, Chris,
you know,
I'm happy to jump in briefly and then Chris, add anything if I miss it. But I did see that question. And so FY 2021 still included some of the increased COVID emergency dollars. So in particular, childcare saw a hefty investment in the COVID years. And our look back of 5 years still includes some of those investments that were made, some of those really necessary and important investments. So that drop off that Kathleen in the chat mentioned, which is really startling to see, that reflects we're back to sort of normal funding levels from the COVID dollars that we saw in childcare. Those COVID dollars, meanwhile, should be the norm in our opinion. They really helped states shore up their programs, kept childcare providers' doors open, kept professionals and workers' jobs secure, left them from leaving the field, and kept costs down for families. So we would like to see greater investments in that area, but that is I think that's the main reason why we see that big drop off. Chris, am I forgetting anything
No,
there?
that's right. That's right.
Okay.
And then just to answer one quick question in the chat. There are supposed to be protections for parents with children 13 and under. Will those make any difference? Yeah, so a lot of like the Medicaid and the SNAP cuts. Well, is it SNAP? Definitely Medicaid. They're supposedly no one is supposed to be kicked off of Medicaid for work requirements who is, under, yeah, I think it's under 14. Um, that's good, but just the fact that the work requirements exist and there's all this extra bureaucracy and red tape means an extra hurdle, even for families, that do have kids under 13 that could still lead to reductions in access. Also, there are other provisions in there that we are definitely worried about, such as limits on the ability of states to raise revenue through provider taxes, which, will mean that there's less revenue coming in to support Medicaid, which could lead to cuts for children. There's also things like cost shifting measures in the bill that are putting more of the burden on funding SNAP to kids to states. That means that they have to raise a bunch of extra money. It probably will mean a reduction in SNAP, but if they have to allocate resources away from to support that huge decline in SNAP funding, that means other things might be on the chopping block. So, um, some of this is so unpredictable because we're just making it so much harder for states and their budget situations that we don't know what's going to be cut. It could be education, it could be early childhood health, it could be really long reaching and all over the place. So there's lots to be worried about, and we do not think that protections for kids are nearly enough to stave off worries at all.
thank you, Chris, and Avery, thank you for jumping in. Chris, that was excellent. Really nicely done and a lot of good information there. And you helped with a nice segue into our special guest speaker. So next, I'm pleased to introduce Dr. Granillo, CEO of AVANCE, where she sets the vision and strategic plan for the organization and engages key stakeholders and advocates to elevate the mission of AVANCE. Dr. Granillo also serves on the National Advisory Council for the Hogg Mental Health Foundation and the Board of Directors of Unidos US, and holds a dual PhD in social work and psychology from the University of Michigan, Go Blue. Again, Dr. Granillo, we appreciate you joining us, and I think you will have lots to share, overviewing your mission and work, and talk about the children and families you serve and how the recent federal budget and policy decisions are shaping AVANCE's efforts, affecting families' daily lives and impacting the workforce even. So thank you again, and I turn the virtual floor over to you. Welcome.
Thank you, Michelle, and to Chris and Avery and the First Focus team for the data and with the context setting, but also for inviting us here today to share our perspective and our work in the great state of Texas. So I guess I'll start with something that Chris mentioned, and that is that Texas does receive the most amount of federal dollars for babies than any other state. And that is because we need it. 1 in every 10 babies born in the US are born in Texas, and nearly half of the babies born in Texas are on Medicaid. In fact, Medicaid is the single largest payer of maternity health in our state. And so while Texas has actually made great strides in expanding Medicaid coverage for up to 12 months postpartum in recent years, soon, as we've heard, that can all be undone. And the federal funding for babies and mamas in Texas is critical because 1.1 million children in Texas are uninsured. It's the highest rate in the country. About 21% of children in Texas live in poverty. That's above the national average. Infant mortality is about 1.8 per 1,000 births, with Black infants facing significantly higher risk. Black mothers are 2 to 3 times more likely to die from pregnancy-related concerns or causes. And even with additional investments recently in our child care subsidy system, close to 100,000 children are still currently on wait lists for child care subsidies, and with the greatest shortages for infants and toddlers. And so while our state may receive the most federal funding for babies, many families are not experiencing these investments because of barriers to access, limited supply, and system fragmentation. So too many dollars actually never make it all the way to the child. And so this is one of the things at Avance that we do. We help families navigate these systems to access resources and advocate for their needs and the needs of their children. We've been operating for over 50 years in Texas. We've been serving families with children under the age of 5, the most critical years. And in Texas, we are the largest early childhood organization with 87 sites across the state, where we provide high quality early learning and parent support services. Over 80% of our budget comes from Head Start, Early Head Start, serving about 3,700 children and their families through Head Start and Early Head Start services. And while we serve all communities, we predominantly serve Latino families, and we serve in rural communities, and we reach those who are furthest from justice. As direct service providers to over 18,000 individuals annually, we know the struggles our families already face with accessing food and healthcare services. And with HR 1 looming, we are about to see massive shifts in child health, maternal health, and overall family well-being. And it's not looking good. So I don't know if we want to jump straight into that. So, Michelle, you can let me know if you want me to get right into the potential impact that we are seeing on the ground of you.
Yeah, I think the on the ground impact is good to share, particularly because I think it resonates when we're doing our work in DC. And so I think that is important work. And then there might be follow-up questions, but in addition, Dr. Granillo, if you can talk about some of the work you would recommend as new ways and new solutions to address the challenges and the real life impacts you're talking about. So thank you for sharing that.
Yeah. So first and foremost, if babies and their mamas lose Medicaid coverage during the first year of life, we have increased risk of missing well visits, vaccines, developmental screenings, and the potential chronic illnesses like asthma not being treated or developmental delays not being identified and treated early. This is the most critical time of a child's life. We cannot afford for them to experience untreated health issues or lack support services that they need. And mothers may lose access to mental health care and chronic disease treatment or follow-up visits. And that increase of maternal depression, or I should say increased risk of maternal depression or untreated health conditions, reduced ability to breastfeed or maintain routines, all of those directly affect infant development and bonding. And so ultimately, the financial burden of medical care will either prevent families from accessing the care that they need and their children need, or the medical bills will eventually put them in such a financial strain they will end up with unstable housing or having to make choices that they wouldn't otherwise make. We worked recently with a mother whose baby became sick right as she was trying to navigate the Medicaid enrollment process, and her coverage hadn't gone through yet. In that moment, she was just worried about her child's health. She was trying to figure out how to get care without insurance. And she reached out to AVANCE, and we were able to step in right away, connecting her to a local clinic that could see her baby at a low cost while also helping her get back on track with her Medicaid application. It's a reminder that for families, when a temporary gap in coverage happens, it's a crisis. And having someone there to help navigate them in that moment can make all the difference. Now let's talk about SNAP. Currently, about 1.6 million Texas children receive SNAP benefits. With the proposed changes in SNAP, not only would almost 300,000 families lose benefits due to the new work eligibility requirements and lack of funding, but the state will have to make, like Chris said, some hard decisions about the budget. It would cost $90 million more per year for Texas to maintain the current SNAP benefits, not to mention the potential costs for errors in administration. So many of our families at AVANCE, they rely on SNAP. Even our staff rely, right, on SNAP services and Medicaid. And so this is really critical. We recently worked with another mom. She had 5 children and lost her job and her SNAP benefits at the same time. She described feeling completely alone and overwhelmed, unsure of where to turn or how to navigate the system. And she came to us, and because she knew we wouldn't judge and that our team would connect her to whatever resources that we could. And so we did. We helped her get connected to a local food bank and get food for her family and help her re-enroll in SNAP. And just as important, we stayed with her through the process, scheduling follow-ups and making sure she remained connected to the support she needed. Because in moments like that, it's not just about access, it's about having someone walk alongside you until things are stable again. So in Texas, we're navigating a perfect storm. We already have more than 1.1 million uninsured children. At the same time, we're facing major federal funding shifts under this new HR1, and also, the state is being asked to take on significantly higher costs for SNAP, while also implementing new requirements that make it harder for families to stay connected to services. So this ultimately is just, again, the perfect storm for Texas. And so the question in front of us isn't just how we manage these changes, it's whether we use this moment to strengthen the systems that families rely on, or whether we allow more children to fall through the cracks. So what can we do? Even in this moment, there's actually, it looks like doomsday, but there's some real opportunities for Texas to lead if we choose to prioritize the earliest years of life. So at AVANCE, we focus on being the bridge between families and systems, connecting families to food, healthcare, and early learning, supporting parents as their children's first teachers at home, building trust and navigation support. But beyond what organizations like AVANCE can do, there's a bigger opportunity in front of Texas. But it will take big movement from our legislators. It will take our legislators believing in the importance of investing in the earliest years. So in Texas, we have the benefit of having sovereign wealth funds, oil and gas money. That's already allocated to our budget. There's a permanent school fund that is valued at over $86 billion, specifically focused on education, K through higher ed. So the question is, what if we invested just 1% of that fund into early childhood? Our neighbors in New Mexico did this, and now they have a $9 million fund dedicated to early care and education in their state. What if we created a dedicated, sustainable funding stream for the prenatal to 3 window, supporting childcare access, maternal health, and early learning? Even in this moment, there are clear opportunities to protect and strengthen outcomes for children. So I guess I'll close with saying, like, organizations like AVANCE, we play a critical role in bridging the gap, building trust, connecting families with services, and ensuring that support actually reaches children. And, Texas has the scale, the resources, and the need to lead the nation in early childhood outcomes. We don't have to wait for federal solutions. We can build a model that reflects the realities of our families and the future we want for our children. At the end of the day, this isn't just about programs or policy. It's about whether families have what they need during their most critical years of their children's lives. And in Texas, where so many of our country's children are born, the stakes could not be higher. The question is whether we meet this moment by pulling back or by stepping forward. At Avance, we're committed to stepping forward alongside families every step of the way.
And we at First Focus on Children are with you on that and appreciate a bit of the looking around at what other states are doing and thinking, can we do something similar? And I know a little bit about what New Mexico has done, and appreciate you mentioning that and sort of the positive attitude, because I think what you said is right. Do we use this moment to strengthen the system for families and children, or do more kids fall through the cracks? So appreciate you sharing that with us. I'm going to pivot over to Avery, but Dr. Granillo, if you have comments in this regard too, please do step in. And you heard Chris talk about this, but of the programs tracked to this fact sheet, maternal and infant health make up over half the federal funding going to states. So Avery, what trends are we seeing in federal funding for maternal and infant health programs? Are they good or bad? And why is this important? And what's happening nationally? And then again, Dr. Granillo, welcome comments in this regard for the state of Texas as well.
Thanks, Michelle. So just to set the scene, which many of you all know very well, actually, maternal mortality rates have declined from their peak during the COVID-19 pandemic. And the good news is that 49 states and the District of Columbia have now expanded their postpartum Medicaid coverage to 12 months. However, the United States still ranks among the highest in developed countries for maternal and infant mortality rates. And these rates vary widely by race. I want to highlight the infant mortality piece there as well, which I don't think there's quite as much attention paid to sometimes. But in 2022, the infant mortality rate in the United States actually rose by 3%. That was the first increase in 20 years. So we still continue to head in the wrong direction. The funding trends at the federal level for programs that we have tracked, that Chris has done great work in tracking, they receive just 0.81% of all federal spending. So that amount is wholly inadequate to meet the challenges that babies and their mothers face. And it is a small portion of what is needed to address those numbers that I just went through. You'll see if you look at through our materials, we do show a 50% increase between FY21 and FY25 for infant and maternal health programs. However, that number is misleading because the vast majority of that increase is due to increased Medicaid spending, which is great. Medicaid, obviously, as we already went over, disproportionately positively impacts babies. So an uptick in spending on Medicaid is a positive thing, but this uptick reflects automatic increases, as was discussed earlier. This is a mandatory funding stream. It reflects factors like population growth or increased participation rather than policy choices and changes that are made at the federal level. And as has already also been discussed, Congress has passed and the president has signed into law through H.R. 1 drastic cuts for Medicaid over the next decade, and we expect those cuts to be reflected in future numbers that we track. So in the meantime, funding for discretionary programs in maternal and infant health, which are the programs that Congress has to decide each year what levels to fund at, those have failed to keep up with inflation. So we see negative trends. Recent years of flat funding for some of these programs that have shown themselves to improve rates of maternal and infant mortality Some of these programs include Healthy Start, the Maternal and Child Health Services Block Grant, and Infant and Early Childhood Mental Health. Those programs have been flat funded, and that means real cuts in real dollars to those programs. The president's budget proposals have also included the elimination of some of those programs. So we need to stay vigilant and ensure that those programs continue to be supported. And I think there's broad agreement that our rates of maternal and infant mortality are too high. That is a statement that has great bipartisan support in general. But we're not going to be able to meaningfully change those numbers without significant federal investments in the programs that have shown that they can move the needle. So thanks, Michelle. Dr. Granillo, do you want to add anything to that from the Texas perspective?
Okay.
I know you already, yeah, addressed this to some extent.
And I appreciate that, Avery. And again, we're, fighting on both sides, the mandatory and the discretionary programs. With that, Chris, the last question I had is for you, but I suspect others may have comments as well. So we've been talking a lot about some of the obvious safety net programs that we think of that benefit kids, the Medicaid support, the healthcare, and the SNAP nutrition supports. But many of our most important programs that uplift our youngest children are actually embedded in the tax code, such as the child tax credit and the earned income tax credit. And I know those are part of your tracking and your analysis. And you talked about this a little bit earlier, but can you go back to that and discuss the importance of these tax credits for our younger kids and remind us what we saw during the pandemic and how we can make significant policy changes that really make dramatic improvements for babies and toddlers? So I turn it over to you.
Yeah, we really care about the tax code as well as the spending programs, because America, especially, a lot of the policy that we do is through the tax code, whether that's, who we decide to tax, but also credits that can either reduce people's tax burden, or in the case that we really care about, is the tax code can be a way to give money directly to families who need them. And so the EITC is one of those where low income people get access to a credit. So instead of owing taxes, they actually get money. And I think the income tax credit is one of our five biggest programs that we track. So it's a really substantial pot of money. The one we're would be really excited about for sure is the child tax credit, though. So we do have a child tax credit, which gives a tax credit to people with children, including babies, obviously. And like I said earlier, the big problem with it is that you have to make a certain level of income to get the full child tax credit. And so people on the lower end of the income spectrum, people, the poorest families with babies are not getting that full amount. They're getting a lot less. And so, one of the single biggest changes we could make to invest more in babies is to make the child tax credit fully refundable, meaning that everyone who is entitled to the full credit would get the full credit. And so, if you have really low income, uh, um, you would basically get extra money in your pocket because of this refundable child tax credit. Also, during the pandemic, the other thing I did mention is that we actually increased the maximum amount for children 0 to 6. So we could totally consider, upping the amount as well for the youngest children. And to give you a sense of how important this is, Medicaid is by far our biggest program that we track in the book. It pretty much every year it's just going to dwarf everything else because healthcare is so expensive, that's such a big need, and Medicaid is just the most important medical program that we have for kids. But when the Biden administration in its 2025 president, the most recent president's budget that they proposed had a fully refundable child tax credit and increased the maximum amount for children 0 to 6. And if that had been implemented, that would have become the biggest children's program. So the fully refundable child tax credit at the very least rivals Medicaid as our biggest program, or would even maybe become the single biggest children's and potentially babies program. So if there's just like one policy change to really put more money in the hands of babies, that would be a really great one to make the child tax credit fully refundable. And the great thing about the child tax credit is families can decide what to do with that money. So a lot of the spending programs are for healthcare, for nutrition. They're kind of for a specific purpose, whereas a child tax credit is just money in your pocket to meet whatever needs you have. And so I think that's a nice advantage of it that complements these service-based programs pretty well.
And thank you for that, Chris. And I would add on top of that just the breadth and depth of research out there that shows how effective the fully refundable child tax credit was when we had that for a year. And a couple of additional things. It was delivered on a monthly basis for 6 months. And we all know that your rent and mortgage and your food bills and your electricity bills, they don't come due at the end of the year when you're doing your taxes. They are a monthly need. And that was a really important thing. And it was probably the expanded child tax credit was probably, no, not probably, it was the largest driver in the different program changes that ultimately led to nearly a 50% reduction in child poverty. And since then, child poverty has more than doubled since that time. So another area where we're going in the wrong direction when we actually know the policy changes and investments that work and work really well. So thank you for talking about that. And then I will pause as we're nearing top of the hour here and just see if there was anything in the chat that I missed while I was talking now. And if not, then I would just say thank you again to our participants today and sharing so much important information, including some of the solutions that we see out there, and we'll continue to do good advocacy work to pass and implement. So thank you all. Thank you, our Texas partners and friends, and thank you everybody for joining us today. Take good care.